Substance Abuse and Prevention in Pinehurst, North Carolina. Presentation by Holly Eatman, Amy Edens, Abby Russell, and Steve Jones. Here's our windshield survey. Pinehurst, North Carolina boundaries. It's bordered by several other towns that are also included in Moore County. Major surrounding highways include the US 15501 corridor and US 1 South. These roads provide easy access to major cities that include Raleigh, North Carolina, and Fayetteville, North Carolina. Most people refer to the Pinehurst area as the Pines. Pinehurst has numerous houses that include both middle-class and upper-class citizens. Houses are new and old and range in price from less than $100,000 to over $1 million. Outlying neighborhoods provide a Pinehurst address with affordable housing for middle-class citizens. Home buyers have endless opportunities to purchase old or brand-new homes. Most houses have heating, air conditioning, and modern plumbing. Open space. Any space not occupied by residents in the Pinehurst area is filled with pine trees. The county extends much effort into maintaining the landscape with beautiful flowers. Pinehurst has been named one of the safest towns in North Carolina by many magazines and journals, on more than one occasion. The commons of the neighborhoods. Many people use the sidewalks and trails to run or walk. Many bring their pets along too. Most persons on the road during the day are comprised of landscapers and construction workers who put much effort into keeping the area attractive. Animals that may be seen include deer, rabbits, turtles, and of course dogs and cats. Transportation. Most people get around with their own cars. However, it is not uncommon to see golfers cruising around in their golf carts. Pinehurst also has a taxi service available to all residents. Race and ethnicity. Pinehurst is largely comprised of Caucasians. However, the town is full of opportunity for all. The area is largely attractive to young families who are planting their roots, but also to retired couples who love to golf. There are endless restaurants, including places that are locally owned. English is the primary language for the area. Religion. Pinehurst also contains numerous churches. While most people claim to be members of the Christian faith, other religions are infiltrated within the town as well. There is no shortage of worship centers. All denominations are included. Politics. There's a great mix of politics between both Republicans and Democrats. During the most recent presidential campaign and election, I learned that residents are not shy about letting their voices be heard. Residents are not afraid to display yard signs in support of their political parties. The local commerce. These include social service centers. Pinehurst is filled with medical centers, a large hospital, pharmacies, dentists, parks, social work offices, banks, and much more. In fact, healthcare is a main source of job opportunity for those who reside in the area. Business and industry. While there are many local businesses, some main employers of Pinehurst are the hospital and surrounding healthcare facilities. The town of Pinehurst also supplies much employment opportunity. Retail, dining, banking, and real estate are types of employment opportunities that present for people seek when moving to the area. Health indicators. There is a large hospital in the town as well as trauma centers less than 90 minutes away. As NICU nurses who work at these hospitals, they are well aware of the increasing incidences of substance abuse cases in the area. Many of our neonates are born addicted to opiates due to their mother's abuse while in utero. We had a key informant interview with Karen Wicker. She's the executive director of Drug Free Moore County. Drug Free Moore County is the nonprofit coalition that serves the Moore County area. This includes Pinehurst. DFMC's mission is to educate and instill awareness into the public regarding prevention, intervention, and treatment of substance abuse in Moore County, North Carolina. The program was established 20 years ago. 3 years ago, the board decided to gear the program more towards the community and its families. DFMC serves many populations in the area and supports many annual activities. Ms. Wicker reports that substance abuse is a big issue in Moore County. She states that a huge goal of the organization is to educate parents and teachers. Ms. Wicker also reported that in this area, drug abuse is often seen in those who have a history of mental illness and or another form of abuse, physical and emotional, as well as others. A dual diagnosis is very common. Cause for concern with these programs is that there are no programs for pregnant women. In Moore County, there is one Medicaid-assisted program, a methadone clinic in Pinehurst. This program is voluntary and enables pregnant women to receive treatment for their substance abuse. They are given daily dosages and eventually are weaned off of the medication. However, many pregnant women are not in this program, and as a result, their infants are born with neonatal abstinence syndrome. Hepatitis C is also becoming an increased issue, as more people are shooting up drugs and sharing needles. Many people refuse to get involved in DFMC before it hits home. Mrs. Wickers stated that the program needs more involved advocates now, but many wait until this issue is affecting their own lives before they get involved. Some barriers to the program's growth and treatment. Those include limited involvement from volunteers. She said she needs more boots on the ground. There are limited monetary funds. Most treatment facilities are in one area of the county. This makes it difficult for those at the opposite end, of course people not living in Pinehurst, to obtain these effective treatments. There are limited resources for recovery. The local hospital in Pinehurst, North Carolina, does not detox patients from opiates in the ER. Moving forward, more recovery programs are needed in Moore County. There are no in-house recovery programs in this county. The only options for in-house recovery are private counseling and one treatment center, which is often at capacity. Addiction support groups. DFMC offers many support groups free of charge for those seeking help. Most of these groups meet on Saturdays. Some local initiatives. The Bedroom Project. This includes bedrooms set up with hidden drugs in an effort to help parents find and recognize the substances that are of possible harm. Another recent initiative, The Elephant in the Room, was a project geared towards educating teachers to recognize parents of students who are under the influence of substances. Mrs. Wickers shared that DFMC supports many big events that help educate the public. An upcoming event in September 2017, called Run for Recovery, will include races, food, and information for the public in an effort to educate people about the disease. And here's our secondary analysis. Our Pinehurst demographic profile includes an estimated population of 15,945 souls. Genders include 53.4% female and 46.6% male. The median age here is 61. We comprise 92.8% white, 3.8% African American, and 2.1% Hispanic or Latino. The rest comprise of Asians at 1.3%. The median annual income is $74,849. The median value of ownership of occupied homes is at $239,000. 1.8% of the people in the county live below the poverty line. The cost of living in Pinehurst is 9.6% higher than the national average cost of living. Of course, renters make up 11.4% of Pinehurst. And between 2011 and 2015, the median gross rent was $1,558 a month. Employment opportunities in this town include the two largest employers, which are First Health of the Carolinas and Pinehurst LLC. The unemployment rate sits at 5.1%. The three selected health priorities for 2014 through 2017 were obesity for children and adults, substance abuse, including tobacco, and aging issues. The top 5 unhealthiest behaviors identified as having the largest impact on the community were illegal drug abuse, alcohol abuse, smoking, tobacco use, prescription drug abuse, and lack of exercise. Drug-related arrests were on the decline until there was a small resurgence in 2012. 48% of Moore County's opioid overdose deaths were attributed to opioid medications. From 2011 to 2015, there were 84 related drug overdose deaths. 2.2% report they or members of their households have used illicit drugs in the past year. 3.6% of those report they or a member of their household have abused prescription drugs in the past year. Smoking was rated third as one of the unhealthy behaviors having a large impact on the community. 23% were current smokers and 7% were using other tobacco products. 19% of the smokers did not want to quit. 17% did not know who to contact if someone was having a mental health or substance abuse problem. In 2012, 12.3% of mothers smoked during their pregnancies. Alcohol abuse was rated second as one of the unhealthy behaviors having a large impact on the community. 7.6% of residents participate in binge drinking. 4.6% have sought professional help for drug or alcohol problems at some point in their life, and alcohol was identified second by parents as an issue their children need more information about. The community diagnosis and interventions. Our strengths here include nonprofit programs to assist individuals suffering from substance abuse problems. These programs are events that help educate parents and teachers on how to recognize substance abuse signs and symptoms in younger populations. The dedicated task force, which is part of the Moore County 2020 task force, helps identify and research drug abuse throughout Moore County to help advance drug prevention programs. This committee includes the school system, cooperative extension, the health system, law enforcement, Department of Social Services, Drug-Free Moore County, healthcare providers, and the health department. Help increased educational opportunities for the community, fundraising, implementation of evidence-based prevention programs. Some problems and weaknesses from these programs. Limited monetary funds for substance abuse education and assistance. A lack of facilities for individuals to detox or receive assistance in. The Sandhill Center. This helps develop, manage, and assure individuals to have access to mental health, developmental disabilities, and substance abuse services. It serves 9 counties, which spreads resources thin. The helpline available 24 hours a day, 7 days a week is with licensed clinicians. Ease of access for illegal and prescribed drugs for individuals to misuse. Significant health problems. The younger population are at risk for substance abuse. Moore County in 2011-2012 had 32 cases of substance abuse in youth younger than 18. An increased number of adults greater than 18 cases of substance abuse occurred in the county. 2011-2012 saw that there were 526 cases reported in Moore County. That led to an increased number of drug overdoses, and from 2011 to 2015, there were 84 drug overdose deaths in Moore County alone. Substance abuse is a growing problem in Moore County. In 2016, 48% of narcotic overdose deaths were attributed to opioid medications. This is a significant health problem, as a lack of information available for individuals to seek help exists. 23% of individuals say they would seek or talk to a physician, 22% say they would contact a private therapist, and 17% did not know who to contact if they had a substance abuse problem. 69% of parents did not believe their children were engaging in risky behavior, which leads to a less educated parental guidance. Strengths of the programs. There is a medication drop available to Moore County residents where individuals can drop off unused or expired prescription drugs to help prevent misuse, accidental poisonings, and or overdoses. 2016 Moore County Operation Medicine Drop collected an estimated 702,085 dosage units, or 936 pounds of unused or expired medications. An updated and published comprehensive resource guide is available for those seeking drug prevention, treatment, and support services in Moore County. There were 4 SODA, Stop Overdose and Drug Access, presentations given by the Drug-Free Moore County Committee. Programs are aimed to educate parents on signs and symptoms of substance abuse, like behavior patterns, hiding sports, paraphernalia, those kinds of things. Those presentations reached approximately 200 individuals. We also have the Sandhill Center here. This helps develop, manage, and assure individuals who have access to mental health, developmental disabilities, and substance abuse services persist. The helpline is available 24 hours a day, 7 days a week, and is employed with licensed clinicians. Interventions available include education for individuals in Moore County on signs and symptoms and their behaviors of substance abuse in adults and children. Involve the hospital, health department, and other health-related facilities and individuals will help with this education. Establish an educational program for the entire county on where to get assistance for individuals with a substance abuse problem and where those individuals or their families can go for assistance. We need to offer more therapies like individual, group, or family counseling for those individuals suffering from substance abuse problems. Increased funds to help with education is also a need. Thank you very much for listening to our presentation today. Here is a list of our references. You can contact the Moore County Health Department at this address and web address, as well as the North Carolina Health and Human Services Department at this address. Again, thank you very much for listening to our presentation.